All right, let's talk about diabetes, but maybe not in the way you're used to thinking about it. We're going to frame this as a fundamental energy crisis inside the body, a major breakdown in how we use fuel. So let's dive right in. Imagine your body is this incredible high-performance engine, and the food you eat, that's its fuel. Now, what would happen if that fuel, specifically a sugar called glucose, couldn't actually get into the engine's cells to make things go? That question right there gets to the absolute heart of the crisis we call diabetes. Okay, so the technical term for this whole situation is hyperglycemia. It literally just means too much sugar in the blood. And when all that fuel starts piling up in your bloodstream instead of getting into your cells where it's needed, the entire system just starts to go haywire. This is the absolute core of the body's energy crisis. So the big question is why? Why does this fuel system break down in the first place? Well, it really all comes down to this super important hormone called insulin. You can think of insulin as the key that unlocks our cells to let all that glucose in. And the system fails for one of two main reasons. Now, this slide really gets to the heart of the matter. It breaks down the two core defects perfectly. On the one hand, you've got a production problem. The pancreas just isn't making enough insulin. There aren't enough keys being made. But on the other hand, the pancreas could be working overtime, making plenty of insulin, but the locks on the cells are kind of rusty. The cells become resistant to insulin's signal. Ultimately, diabetes is caused by one, or, often a combination of both of these issues. And this brings us to a really crucial point. Diabetes isn't just one thing. It's a whole category of diseases. And figuring out the specific why behind the high blood sugar is absolutely key to treating it the right way. So let's look at the two big ones. In type 1, the problem is a total lack of insulin. It's an autoimmune issue, basically a case of friendly fire, where the body's own immune system tragically attacks and wipes out the very cells that make insulin. With type 2, it's a completely different story. It starts with that rusty lock problem, insulin resistance. Then, over time, the pancreas just gets worn out from trying to pump out more and more insulin to compensate, and you end up with a relative deficiency. This difference in what's causing it also leads to a huge difference in how they show up. Type 1 often feels like it hits you like a truck. The symptoms come on fast, and they're often severe. Type 2, on the other hand, is much sneakier. It's more of a slow burn, developing gradually over years and years, sometimes without any obvious symptoms at first. And get this number is staggering. While both types are serious, type 2 diabetes makes up about 95% of all cases. It's that slow, creeping nature, often tied to things like diet and physical activity, that makes it such a massive public health challenge. And the story doesn't even stop there. There's a whole spectrum of other types, from gestational diabetes that shows up during pregnancy, to rare genetic forms, and even diabetes that's caused by other medications. It just goes to show you this is a really complex family of conditions, not just a single disease. So, when the body's in this state of high blood sugar, it's not going to stay quiet forever. Eventually, it starts sending out some warning signals, some flares. Let's take a look at how to recognize those signals and how doctors make a formal diagnosis. These are the classic warning lights on your body's dashboard. When there's too much sugar in the blood, your kidneys go into overdrive trying to flush it out. That's what leads to all that thirst and urination. And because your cells are starved for fuel, you feel tired and weak. That unintended weight loss, that's a huge red flag, especially in type 1. It means your body is so desperate for energy, it started breaking down its own muscle and fat for fuel. Now, to officially confirm a diagnosis, doctors have a few key blood tests in their toolbox. The A1C is fantastic because it gives you the long-term view, your average blood sugar over the last 2 to 3 months. The fasting plasma glucose, or FPG, that's more of a snapshot of your blood sugar after you haven't eaten overnight. And the OGTT tests how your body handles a sugar load over a couple of hours. Each one gives a different, really valuable piece of the puzzle. Okay, so a diagnosis is made. What's next? Well, management is a lifelong journey, for sure, but it's built on a few core foundations that are all about empowering you to take back control. And one of the most practical, hands-on tools for day-to-day management is the plate method. It's beautifully simple. You fill half your plate with non-starchy veggies, a quarter with lean protein, and the last quarter with carbs like whole grains. This, plus regular physical activity, really forms the bedrock of blood sugar control. For many people with type 2, lifestyle changes go hand in hand with medication. And the typical starting player, the first-line drug, is metformin.
What's cool about it is that its main job isn't to force more insulin out of your pancreas. Instead, it works by telling your liver to just calm down a bit and turn down the tap on the extra glucose it's been producing. But here's where things get really exciting. Modern diabetes care has totally evolved. The goal isn't just about lowering a number on a glucose meter anymore. We are now in an era where the focus is on protecting the entire body from the long-term ripple effects of the disease. And that leads to this critical question. Yeah, lowering blood sugar is essential. We know that. But what about protecting the heart, the kidneys, the blood vessels? Can we do more? The answer, thankfully, is now a huge, resounding yes. Two newer classes of medications have been absolute game changers. SGLT2 inhibitors help the kidneys flush out extra sugar, but, and this is the amazing part, they also provide powerful protection for the heart and kidneys. And similarly, GLP-1 receptor agonists do way more than just help with insulin. They protect the cardiovascular system and can help people achieve significant weight loss, which tackles another key piece of the type 2 puzzle. So why is all this organ protection talk such a big deal? Well, because chronically high blood sugar is really tough on blood vessels all over your body. You get macrovascular damage, that's damage to the big vessels, which leads to heart attacks and strokes. And then you get microvascular damage to the tiny, tiny vessels. And that's what causes these devastating complications in the eyes, kidneys, and nerves. But here is a super important and kind of counterintuitive point from doctors in the field. If someone has had very, very high blood sugar for a long time, dropping it too fast can actually make some of those microvascular problems, like in the eyes and nerves, temporarily worse. It's a bit of a shock to the system. So the big takeaway here is that slow and steady wins the race. For patients who are starting out with really poor control, the goal is gradual improvement. The recommendation is to aim for a reduction in their A1C of less than 2 percentage points in the first 3 months. It's just a powerful reminder that healing the body is a marathon, not a sprint. And that brings us to our final thought. With treatments that now go beyond just sugar control and actively protect our organs and promote overall health, the whole paradigm is shifting. The goal is no longer just managing a disease, it's about preserving a high quality of life for the long, long term. And it leaves us with this really hopeful question. What will a future that's truly free from the complications of diabetes actually look like? Thanks for tuning in.